and hello world! I'm nurseniezl and welcome back to my channel. As you can see on the thumbnail of this video, I am going to show you how to do an assessment. So I'm going to do an A to E assessment. But before we head into it, I'm gonna need you to give this video a like and subscribe to my channel. Also, if you wanna get notified just in case I post more videos, then hit the notification bell right over there. So in this station, you're gonna be given 20 minutes, okay? You need to verbalize what you are doing and you have to complete the observation. You will fail if you actively dismiss the patient's complaints or concerns, or if you did not calculate the new score, GCS score, accurately, and if you don't escalate it. You will fail if you did not do an A2E assessment. Remember, we have our airway, breathing, circulation, disability, and exposure. You have to do all this A2E assessment systematically. You can also fail if you didn't utilize the correct or appropriate PPE. Oh, this one is important. If you fail to do an ID check, then it's gonna be a fail. Lastly, if you fail to record or even acknowledge the patient main care needs. Okay, whatever the patient throws to you, because when you get here on this exam, you're gonna be facing an actor. Or even if it's not an actor, then it's gonna be, the examiner is gonna be telling you the complaints and everything. Who's gonna be your patient. This video is solely for demonstration purposes as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden Manual of Clinical Nursing Procedure 10th edition. All information presented are public domain materials accessible through the relevant governing organizations' websites. Subtle similitude may be noticeable, however, this is not intended to be definitive guide to the NMC Part 2 Test of Competence or the OSCE examination. This can be a helpful material for overseas or internationally trained nurses to learn and adapt to the UK clinical settings and transition effectively into practice. You will be given papers in which you need to read the candidate briefing, including the patient scenarios, consisting of the patient information, presenting complaint, past medical history, social history, drug history, allergies, and other relevant information regarding the patient. Take your time to read the scenario. However, you have to take note, you will only be given 20 minutes. Okay, reading the scenario is included to that. These documents will be given to you for your use only. It is not marked by the examiners. You may or may not write on it. You can do the hand washing, the actual hand washing on the sink, or you can do the hand gelling. Okay, so I'm gonna gel now. I'm gonna gel my hands according to the World Health Organization. So I'm gonna do a 5 backward and forward stroke from palm to palm, right palm over the left dorsum, and vice versa. Fingers interlace, back of the fingers interlock, rotation rubbing of the thumb, rotation rubbing with finger clasp, and rotation rubbing of the wrist. Now let it try for 30 seconds. I'm ready to go to the patient, but let me just wear the PPE. Before approaching the patient, I need to assess the scene safety and the privacy and dignity of the patient. Hi!
Hello.
I'm nurseniezl and I'm going to be your nurse for today.
Oh, hi.
Before we start, would it be okay if I just check your ID, your wristband, if that's alright?
Of course.
Okay. Would it be okay if I touch you?
Yes.
Okay. Right. Can you tell me your full name, please?
My full name is Robin Good.
And your date of birth?
1st of the 2nd, 1956.
And I can see that your hospital number is N111222. And I can see that you're wearing a red wristband. Are you allergic to any food, medication, or latex?
I'm allergic to penicillin.
What kind of allergic reaction you get from that?
Usually got rashes.
Rashes. I can see that here in your file, it says here that you are allergic to penicillin and you have got rashes as an allergic reaction. I'll make sure that we're not going to give you any penicillin derivative, okay?
Alright.
Okay, at this point, I need to ensure to use clear communication and maintain good body language. Sorry, what do you want me to call you, by the way?
Just call me Robin.
Okay, Robin. Do you have any pain at all?
Yes, a little discomfort in my chest.
Okay. From 0 to 10, 0 being no pain and 10 being the worst, can you rate your pain?
3?
Okay, do you want some pain relief for that?
No, I'm okay for now.
Okay, cool. So, would it be okay if I proceed with the assessment?
Yes, please.
Okay, so basically, I'm gonna do an A to E assessment. So I'm gonna need to assess your airway, breathing, circulation, disability, and exposure. So that being said, I'm also gonna ask you a series of questions, if that's alright.
Okay.
Okay. Before we proceed with the assessment, I can see that you have alcohol, cigarettes, and lighter beside you. So I'm just gonna remind you that this is a non-smoking institution. So I'm gonna need to collect all this, okay, and the lighter also because this is a fire hazard, and then put it in the safe, if that's okay with you.
Oh, okay.
We're gonna give it back to you once you are ready for discharge. Is that
Alright.
alright?
Alright, nurse.
Okay, let me just take them. Okay, I'm gonna proceed now with the airway. I can see that the patient can speak clearly in full sentences and also there's no visual obstruction. Robin, would you be able to take a deep breath, please? Also, are you able to cough?
Yes.
Okay, I can see that the patient's airway is clear. I can see that there is no audible respiratory noises such as rattle, wheeze, stridor, and coughing. I see no visual signs of respiratory distress such as use of accessory muscle, cyanosis, sweating, and seesaw breathing. Robin, would it be okay if I just put my hands on your chest just to check for the equal air entry? If that's alright?
Okay, nurse.
Okay. I'm gonna need you to inhale. Exhale. Inhale. Exhale. Thank you, Robin. Now I'm going to check your oxygen saturation, okay?
Alright.
Before I start, Miss Examiner, is this machine clean and ready to use?
Yes, it is clean and ready to use.
Okay. Robin, I'm gonna place this pulse oximeter on your finger, if that's okay.
Yeah?
Yeah, would it be okay if I put it on that side?
Okay.
Okay. I can see that the finger is clean. There's no signs of infection. There's no nail varnish. Okay, I'm gonna put the probe now. I'm just gonna check your pulse rate using your radial pulse. Okay, would it be okay if I touch you?
Yeah?
I'm gonna do this for 2 minutes if that's okay. Alright?
Okay. Okay, nurse.
Okay, Robin, while I was doing the full 2 minute, I've spent 1 full minute for your respiratory rate and then 1 full minute for your pulse rate. I didn't tell you that, so it won't alter the result. Alright, Robin, let me go check your blood pressure if that's alright. So I'm gonna place this BP cuff on your arm. Is it okay if I use this arm right here?
Yes.
Okay, I can see that the skin here is clean. There's no signs of infection. There's no wound. Have you had any operation on your right arm?
No.
How about on your right breast?
No.
Okay, so it's okay to use this one?
Yes.
Okay, let me just place it. Okay, Robin. This may cause a little bit of discomfort when the cuff inflates, but it won't take that long, okay? Thank you, Robin. So I can see that your blood pressure is 112/75. Is that your normal blood pressure?
Yes, nurse.
Okay. Would it be okay if I just check your capillary refill? May I? I just need to raise your finger level to your heart. Okay. 1, 2, 3, 4, 5. Okay. You can see that your capillary refill is less than 2 seconds. Okay. I'm just gonna place my hands on your upper and lower extremities to check for the pallor and perfusion. Warm, normal perfusion, and warm to touch. Now for the disability, the level of consciousness of the patient, I can see that the patient is alert and orientated. Robin, you said a while ago that you've got pain. Is it still the case at the moment? Do you still have any pain at all?
Yes, just a little bit.
Where is the location of the pain?
On my chest?
On your chest? Is it from 0 to 10, 0 being no pain and 10 being the worst? Can you rate the pain, please?
It's now 5.
5? Okay, 5 out of 10. Would you like some pain relief for that?
Yes, if I can.
Oh, okay, don't worry. I'm gonna be back after this assessment and give that pain relief for you. Is that alright?
Alright, thank you.
Okay. How's your urine output, by the way?
Oh, I'm urinating a lot because I'm on diuretics. They've given me diuretics in the A&E a while ago because of my swollen ankles.
Oh yeah, I've noticed that one a while ago. That one when I looked at your extremity. So you've got swollen ankles on both feet. Okay. So we need to elevate both of your legs, okay, to reduce the inflammation or the swelling. Also, from now on, we need to take note of your intake and output. So I'm gonna start a fluid chart as well. Do you have any problems walking or going to the toilet because of your because of frequent urination? You may go back and forth to the toilet. Do you have any problems with walking or your mobility?
Oh yes. I'm actually using a Zimmer frame as of the moment, and yeah, because of my breathlessness.
Okay, if you need any assistance, here is your call bell. Just press the call bell if you need anything, okay?
Alright.
Alright. Would it be okay if I just asked regarding your bowels as well? How's your bowel movement at the moment?
I have no problem with my bowels.
You open your bowels regularly?
Yeah.
Okay. And how about your blood sugar?
I'm not diabetic, but they've checked it in the A&E a while ago and it's normal.
Okay, good. So let's come down now to the exposure. Would it be okay if I just check your temperature?
Okay.
I'm gonna place it near your forehead and I'm gonna need you to stay still for a bit so I can have an accurate result, okay?
Okay.
Temperature is normal, 36.6 degrees Celsius. Do you have any bruises or any wounds in your body?
No.
Okay, so your skin is intact.
Yes, yes.
Okay, how about your past medical history? I can see that you have a history of hypertension since 2009 and you have angina at the same time.
That's correct. Back 2011, I got myocardial infarction.
So you've got MI as well in 2011. Okay,
Yeah.
It's here in my record at the same time. Okay, Robin, I am now finished with the assessment. Would it be okay if I just record it and put it in the news chart?
Yeah, sure.
Okay. Robin, we are now finished with the assessment. Your early warning score is 2 in one parameter, which is your respiratory rate, which happens to be 21, is slightly elevated, but I'm not worried about it, and I will continue to monitor you because of that, okay? And that would be every 4 hourly for your news frequency, okay? Check the ADLs this time. There are a lot of questions in the ADLs. You just get to ask the patient regarding the ADLs that has been highlighted during your exam. So it depends if it's physical, psychosocial, sexual, or spiritual, okay? Those are the things that you're gonna ask the patient, okay? Alright, then once you are finished, conclude the assessment. Do you have any other concerns?
No, I'm okay, nurse.
Are you comfortable like that?
Yes, totally.
Okay, if you need any help at all, here's your call bell, okay? Just give us a call, alright?
Okay.
Thank you so much for today.
No, thank you.
Okay, for the machine, I need to clean it after using and let it dry for 30 seconds. I'm gonna remove now my gloves, an apron, gel my hands. And I'm going to wash my hands using the 6 steps of hand washing after the procedure. Okay. And just like that, we are now done with our A2E assessment. So hopefully this video can help you pass your OSCE exam. If you're about to take your OSCE exam, this video is for you. Head on to my channel, which is nurseniezl playlist, to view some more OSCE video. Don't forget to give this video a like and subscribe to my channel. Also, if you wanted to see more, then hit the notification bell. This has been nurseniezl. See you on the next one. Bye!